Are you looking for different ways to diversify your offerings for your patients? Well, today I'm sitting down with Catherine Richardson. She's the Director of Market Expansion and Integration at Cochlear Corporation. Stay tuned. Hey, thanks for joining us today. I'm joined today with Catherine Richardson. She is the Director of Market Expansion and Implementation for Cochlear. Catherine, thanks for joining us today. Can you
Thank
tell
you so
us
much
a
for
little
having me.
bit? No, thank you. Can you tell us a little bit about Cochlear?
Absolutely. So as you know, Cochlear is the leader in implantable hearing devices, and we provided over 550,000 devices to people who need them. And in addition to cochlear implants, we also provide bone conduction devices for those with conductive mixed hearing loss or single-sided deafness. At Cochlear, we really focus on a lot, but specifically, we really aim to do two things. First of all, to make cochlear implantation the standard of care for those patients with severe to profound hearing loss. Secondly, we aim to provide hearing care and hearing services for people for their lifetime. Our promise is to help people here now and always, which means that we have a slew of wonderful services to help them throughout their lifetime to provide the best care. And that includes the Cochlear Provider Network.
Yeah, so speaking of the Cochlear Provider Network, and we just joined here at West Valley Hearing Center in Los Angeles. We recently just joined in the middle of the pandemic, went through everything. And can you tell us a little bit about the Cochlear Provider Network, please?
Yes. So the Cochlear Provider Network, it was developed about 6 years ago out of the need for increased access for cochlear implant candidates. And it's really an exclusive group of cochlear implant professionals that really serves to connect a hearing aid dispensing audiologist with a CI surgeon or CI implant center. So again, the purpose is to increase access for those cochlear implant candidates.
So when you say increased access, what do you mean by increased access?
So right now, only 5% of those patients with severe to profound hearing who could benefit from our technology actually receive it. And there are many factors to this, but one of the main factors is that lack of access for candidates. There are CI surgeons spread out across the country, which is wonderful. But what that means is sometimes it's really difficult or overwhelming for patients to be able to get to those centers to receive that follow-up care that they need following surgery. And the Cochlear Provider Network really helps them to solve that issue by being able to provide activation and programming services following surgery in that local audiology office. Also, a lot of patients that wear cochlear implants also use a bimodal solution, meaning that they wear a hearing aid on the other side. Right. And by having access to their audiologist that they've seen for many years, now they can have hearing care, all of their hearing care services in one place.
Yeah, actually, in the past, when I used to own a couple of private practices outside of Portland, Oregon, and we had a good number of deaf folks that we saw as patients, and we didn't have that bimodal solution back there. But the really cool thing is most of our patients actually had cochlear implants. Cochlear, the company Cochlear implants. And the neat thing was when we put on the implant, their speech understanding at a much lower level was so fantastic. And then you put the hearing aid on the other side, and it was any company's hearing aid because it wasn't even bimodal. But it was amazing to see that you could whisper. You could whisper and they could actually understand what I was saying, which was it just blew me out of, it just blew my mind that this would happen. And I think, some of the misinformation some of the misinformation for a lot of providers is that we send our patients to the surgeon and then we'll never see them again. So as somebody, when I see a patient and I, do my evaluation, I run through a CI evaluation, and now I'm going to send that patient off to the surgeon to get a CI implant. What happens after that?
It's a great question. And I know that that's a concern amongst a lot of audiologists. And within the Cochlear Provider Network, you will have that connection with that surgeon. So when they have surgery, then they will return to you following that for the initial activation and for all of those programming services. You work with that surgeon in that patient journey, and you have that agreement that you're both seeing the patient at different times for different things.
Yeah, and I'm really happy with the connection you guys made for us. He's a surgeon at UCLA here in Los Angeles, and he's been fantastic. And not even just on the CI side. I asked him to do a presentation to a big physician group about CIs, and he was totally open to it. And it was really well received. So I would not have made that connection unless, Cochlear actually made that connection for me. And so as a private practice, we're always looking at, diagnostics, hearing aids, earplugs, tinnitus, et cetera. What are some of the benefits of, implementing a CI protocol or CIs into our practices?
Well, you named one of the big ones, which is, having that connection to the medical community and developing those strong relationships with CI surgeons. But also, and most importantly, it's about having all solutions for your patients. So being able to walk them through that patient journey and feel confident that you have what they need at the right time. And also being along that journey with them and seeing these fantastic results that you were talking about. It's really a benefit to our profession. Also, a big thing about the CPN is you're able to differentiate yourself to the community and in the industry as a multi-specialty audiologist. So you're really expanding that scope of practice. Of course, you're also introducing an alternative revenue source, because as an audiologist, you can bill for CI services. And then we have a lot of partnerships in the industry. And as a CPN member, you can benefit from a lot of additional education and resources and benefits overall from those partnerships.
Yeah, you talk about the education side. So, I graduated with my master's degree just a couple of years ago, actually. Back
yeah, sure.
And I was under my counselor, if you will, at Arizona State was Michael Dorman, who does a lot of research in cochlear implants as well. So I got a good taste of cochlear implants back then. However, I joke, of course, this was back in 2001, 2002, which is actually, we're coming up on 20 years here very shortly. The education part of it. So if I wanted to learn more about cochlear implants, because of course, what I learned back in 2001 is probably not what's happening now. And I'm assuming technology has changed a little bit, probably a little bit. What kind of training can a member of the CPN receive?
That's a great question. So as a member of CPN, we provide all of the training, the support, the equipment that you need to get set up, to be proficient, and to thrive as an audiologist providing CI services. So at the beginning of your journey, we'll put you through a very comprehensive training, but it doesn't stop there. We provide ongoing education monthly via webinars around industry events and in many other ways. So we're committed to keeping you up to date on the technology, because as you said, it does change very quickly. And what you learned 3 years ago will be different today.
Yeah, the training that you talked about, it was, of course, in the middle of the pandemic, and we went through this, I think it was a 5 or 6 week course, and it was very thorough. And, I think as somebody who has a very light baseline, I shouldn't even say it, but somebody who had a little bit of background in cochlear implants, and it's kind of in the back of my head, but then going through this process of learning all this information over those 5 or 6 weeks, which it sounds like a long time, but the reality is that it's only 5 or 6 hours worth of content to expand your scope of practice and diversify your offerings for your patients. I greatly appreciated doing all of that. And there's so many new things. And so the benefit of being in the CPN, I think, is already coming back to us, not even just by education, but even the referrals. But you talked a little bit about benefits of being part of the CPN. What are some other benefits that an audiologist may receive by being in the CPN?
Well, as you said, education is a big part of that, and just really being able to expand that scope of practice. We talked about differentiation in your clinic. we talked about the ability to get the word out in your community. So there's different marketing opportunities and PR opportunities when you are all things hearing to all of your patients. There are connections with our partnerships. So for instance, GN Resound, who works with us with the Bimodal Solution, there's exclusive pricing and things like that for CPN members. So there's a lot of different opportunities for CPNs to continue education and continue to make new connections throughout the industry through CPN, especially with other CPN members, to share ideas and experiences.
Yeah, so we've been talking about CPN and the Cochlear Provider Network, and people may not know how to start. Where do they start? So if somebody wanted to be part of the CPN network, what would be their next step?
The next step would be just to connect with us, and you can do that through connecting with me personally at cpn@cochlear.com, and just having a conversation about the goals of your clinic. And we can talk through what the next steps are as far as training and how to get you started, and we can make it nice and simple.
Yeah, a little shout out to Beth Godero and Amanda Sweet, who have been really pushing us in the right direction in getting this going. And this fall, you guys are going to be joining us on a little boat out of Miami at the AudBoss, the 2021 AudBoss Summit. You were there in the pandemic in Denver, Colorado, where we had our meeting, even though people think we were crazy to do it. We ended up being very successful. What are you going to be talking about at the 2021 AudBoss Summit?
We have lots to talk about. So of course, we'll be introducing the Cochlear Provider Network to those who are not aware of that. But also just the advancements in our industry and maybe some new information around candidacy. So lots to come.
Yeah, and there's so much information. So Catherine, I really appreciate it. And what people don't know is we've known each other for a long time, you know, through varying companies and businesses, et cetera, et cetera. So I really appreciate you taking the time today for joining us and talking about Cochlear and the Cochlear Provider Network. I've listed throughout this meeting at the bottom of our screen, you've seen contact information, websites, and in the description below, I'll have a bunch of information about Cochlear as well. So Catherine, thank you so much for joining me today, and we look forward to seeing you in the fall.
Thank you so much. See you then.